professor of pathology and clinical laboratory medicine. I have over 39 years experience in what we call laboratory medicine, which I've practiced predominantly in the United Kingdom, where I stayed more than 10 years, training and running departments in the United Kingdom. I moved out of the UK and worked in Saudi Arabia for 8 years, again in laboratory practice and setting up, modernizing laboratories in Saudi Arabia. Then I moved to United Arab Emirates, notably the University of Sharjah and the Dubai Health Authority, where I worked for about 5 years as a professor of pathology and laboratory medicine at the University of Sharjah. I also modernized laboratories in United Arab Emirates, because the diagnosis to be made in any clinic requires three things. One, a careful taking of history with the patient's signs, symptoms and signs, and then a workup on why the patient has those symptoms and signs, requires a laboratory, and the laboratory services are not widespread in Uganda. So I have offered specialized laboratory services to this laboratory, would offer them highly specialized laboratory services, and some people are aware of a laboratory called Lancet in Kampala. The services Lancet offers are similar services I've created elsewhere in different countries. So I've come back to Uganda to offer our people those highly specialized services. And while we're offering those services, we are also going to offer a platform of consultants in various branches of medicine, notably internal medicine, surgery, obstetrics and gynecology, and all these subspecialties. I'm going to provide the consultants in each of those areas, a consortium of about 20 consultants who are going to be appended to this idea of the lab. Consequently, if a patient goes to a clinic, we'll assist the clinic to make a diagnosis through the laboratory. Imaging means the scans. These days, X-rays are no longer popular, so scanners, CT scanners, MRI scanners are the things we use, and ultrasound scanners. We shall provide that as well, and on top, we shall provide the consultation. Those three things is what is missing to clinch a diagnosis. Once the diagnosis is made, we shall allow our medical officers, our clinical officers to proceed to treatment. We shall also offer advice as doctors on the best options to take. However, before we get to all that, there's a problem of making diagnosis itself. The laboratory thing I mentioned comes after the patient has presented symptoms and signs. It's at that level where we are also missing, and we needed to digitalize that area, to go computer at this point. We need a software that will allow us to go through a series of questions and answers as the computer leads us into the diagnosis, because the human way of making it simply takes too long. The computer will do that in 5 minutes. So I've invited a company called ThinkMD, whose founder is Professor Barry from the University of Vermont in the United States. Professor Barry is a pathologist as well and a physician. So we have discussed extensively how that software can be applied to Uganda.
So I think the goal of our partnership is to provide clinical technology through an application and software application that provides clinical knowledge base and skill sets to the people using it, and also a data platform that can analyze that data and be used for doing population health monitoring, disease surveillance, and help clinical officers make better decisions regarding the health and the whole organization and how well their users and their clinical officers are working. So the idea is to kind of merge this partnership and to present a package of services and technology and new innovations that can assist in overall better primary healthcare delivery with the Clinical Officers Association.
My name is Barbara Kasana. I'm a Ugandan national. Went to school in Uganda, now living in Vermont, USA. I'm very fortunate to be here as part of the ThinkMD team to help complement and strengthen any efforts that have been ongoing through Professor Lubega and the team as far as implementing or rolling out a diagnostic assessment platform.
Health field is not one man's show, but we have to work collectively with collaborate with other partners to make sure that we give our best to the public. Allied Health Professional Council regulates about 35 professional cadres. I believe some of them are known to us. We have the laboratory personnel, we have the physiotherapists, we have the clinicians, clinical officers, we have the environmental health officers, and many others. But all these, we make sure that we monitor and find out how the trainings are going on in these institutions. And after they graduate, we register them. And after registration, we do follow up to find out what are these people doing in the field. And when these kind of partners, we join hands together with the software that they are developing, I'm very sure we can help improve the health of our people out there in the communities.
We are glad and blessed to have partners like Windsor Laboratory and ThinkMD all the way from the US. We want working with these partners to improve the quality of services being offered by our clinical officers in Uganda, but we want to start with those in private facilities, because afterwards we think that we should have the schools brought on board, because there is no healthcare system for the schools. Private schools are all over the place, and they are not, there is no healthcare package for them planned and the Ministry of Health. So we think that through these innovations, we can be able to bring services closer to our people and change or be able to contribute to this healthcare system.
I agree. Thank you. Thank you so much.
So much for sparing the time.